Hello, everyone. I'm going to get us started. My name is Shaili Prasad, and I'm the Executive Director of the Center for Global Health and Social Responsibility, and the co-lead of the National Resource Center for Refugee, Immigrant, and Migrant Communities, NRC-RIM. Welcome to today's webinar, Mobile COVID-19 Vaccination Campaigns for Refugee, Immigrant, and Migrant, or RIM communities, Practical Considerations. Please note that this webinar is being recorded and will be posted on our website at nrcrim.org. Next slide, please. To begin with, I'd like to acknowledge that this is a partnership between three entities: the National Resource Center for Refugees, Immigrants, and Migrants, the University of Minnesota Mobile Health Initiative, and Community University Healthcare Center of the University of Minnesota. Next slide, please. I know we have all lived in a world of Zoom, but for today's webinar, a couple of reminders. If you go down to your audio settings, if you can please press mute on your audio setting, we'd appreciate that. And there are two other buttons we'd like to remind you of. One is the chat function, another is the Q&A function. The chat function is for you to respond to questions that we are going to pose. In other words, you're responding to us, you're chatting with us. Whereas the Q&A function are your questions for our panelists. So again, chat is when you would respond to our questions, and Q&A is when you have questions for our panelists. But again, don't get too worried about it. If you post your question in one or the other, we won't dock extra points on you, okay? Moving on, a brief overview of our project. NRC-RIM is the National Resource Center for Refugees, Immigrants, and Migrants. It's been funded by the CDC and is housed at the University of Minnesota. We have a network of various actors across the country we are partnering with. Our main job is to support state and local health departments, community-based organizations, and other organizations that work with RIM communities. You can find more about us at our website, nrcrim.org, and please feel free to browse through our website and use any of the resources we have built in that website. Next slide, please. We do a lot around health education and resources around it. We organize online training, including webinars like this one. We compile best and promising practices and develop them into toolkits so that others can use. We provide technical assistance to folks working in RIM communities. We also do some pilot projects, and we work in the field of advocacy. This is a quick overview of all the activities that we do. Next slide, please. Next slide, please. So today's webinar, we will start with some introductions of our panelists. We'll talk a little bit about the importance of providing mobile vaccinations, and we'll present this as a case discussion. We'll also then step into the different steps in arranging for mobile vaccination campaigns. Step 1 to 3 are about organizing the event. Step 4 to 5 is actual planning of the event. And step 6 is holding the event. As you can see, there are more steps than just holding an event. We'll follow this up by a question and answer session, and then have closing thoughts from our panelists. So to begin with, here is our first set of poll questions. Have you ever organized or participated with organizing of a mobile vaccine event? And the next question, how comfortable are you organizing a mobile vaccination event? You should see a poll. And if you can press on that, press your responses on that, we'd appreciate that. Okay. There's your poll. We have a mix here. A lot of folks have not participated in mobile event. And then the rest of them are sort of dispersed from very comfortable to just a few. And the comfort regarding the mobile vaccination event itself is also spread. This is good information for us as we plan our presentation today. So moving on, it's my privilege today to present a fantastic group of speakers. First, I'd like to introduce Dr. Jonathan Kirsch. Dr. Kirsch is an internist and divides his time between inpatient work at the University of Minnesota Medical Center and outreach and education with NRC RIM and the Upper Midwest Agriculture, Safety, and Health Center, UMash. He's been working in mobile health for almost 20 years and currently serves as a mobile health medical director of the University of Minnesota Mobile Health Initiative. Welcome, Dr. Kirsch. Our next speaker is Dr. Opeyemi Adesida. Dr. Adesida is a mobile health program director at Community University Healthcare Center and the University of Minnesota Mobile Health Initiative. In this role, she works with diverse teams to improve health equity and promote access to care through mobile health services. And then lastly, but not least, Dr. Roli Dwivedi. Dr. Dwivedi is a colleague of mine, is an assistant professor of family medicine and community health and the chief clinical officer at the Community University Healthcare Center at the University of Minnesota. She has extensive work experience in underserved medicine. She's an educator and likes to create new models of teaching culturally competent care. She's currently leading a task force that looks at disparities of COVID care at the University of Minnesota. Welcome, Dr. Dwivedi. And with this, I'm going to hand the mic over to Dr. Kirsch to introduce the case. Dr. Kirsch?
Thank you all for being here. And I want you to think through as we go through some of these steps about a population and have some of the people in this population in your mind. And it may be familiar to you from your experiences, it might not be, but it's pretty broad enough that it can touch on a lot of people's experiences and certainly ours personally here. So the town is a Midwest town, upper Midwest town of about 4,000 people. The main employer is a meatpacking facility. This is not a career job for most people at the entry level. Non-managerial jobs are almost exclusively done by refugees, immigrants, and migrants from all over the world. It's often the first job that people take when they are in the US. People rarely stay there for more than a couple of years, and multiple languages are spoken, including Somali, Spanish, Mixteco, which has two different languages in different places, but this one in particular is from Oaxaca, English, and Hmong. Next slide. So you are on a team of people and you're asked, because of declining vaccinations, to get more shots into arms and battle vaccine hesitancy. This may be familiar to other people because it's in the news a lot and a lot of people are dealing with similar issues. But it's easier said than done. So that's hopefully what we'll learn about today. And so, but it's important to understand the historical context in particular for this community, because there was a COVID outbreak in a meatpacking facility in July of 2020. And the facility was contacted to help facilitate and allow testing of workers, and they declined. They didn't want to stop the line. They didn't want to know too much that might affect their bottom line. And some places had been shut down when they found out about an outbreak. So the public health department set up a testing facility at a very large town fairgrounds nearby and invited everybody, free testing, and only the rural white community showed up. The workers did not. Very, very few. About 90% of people were rural white workers. And the point was to have it in town close to where the factory was, hoping that people would come. Next slide. So we're going to go through a few ways of thinking about that, not just showing up and having a vaccine, thinking that that's the end of the job, but thinking about how to develop community partnerships, doing a pre-site assessment, going over some checklists, safety considerations, infection control, and setting up vaccines. So next slide. And so we're going to go through 7 steps. Is Dr. Prasad already mentioned. And so first of all, identifying trusted partners, increasing vaccine confidence, identifying organizations that can help provide mobile vaccinations if you're not one yourself, planning these events, pre-registering, holding events, and then also identifying local vaccination sites for those if you're not able to accommodate them. There are too many people, or if you can't be available in a particular day. So now I'd like to introduce Dr. Rolly DeVetti to go through some of the steps about organizing this.
Thank you, Dr. Kirsch, and thank you, Dr. Prasad, for the warm introduction. I just wanted to take a moment to say why I'm here. So I work at the Community University Healthcare Center, where we serve a very diverse patient population. We see about 12,000 patients, and they come from 12 different racial and ethnic communities and speak more than 10 languages. And when it comes to engaging patients who come here as a refugee or immigrants or migrants, the few things that come to my mind when it comes to any kind of healthcare, and mobile vaccination is one of them, is how do we address trauma? How do we create safe space? How do we build trust? Have community-centered communications, which actions we are taking to reduce the barriers to care, and what steps we are taking to help them understand the intricacies of the Western healthcare system. And COVID actually gave us opportunity to dig deeper in my personal understanding and bigger understanding how these things help build a structure which can be more community informed rather than coming from top down. So the first 3 steps that we will be talking that we as a COOC have done is identifying who are our community partners and increasing vaccine confidence, and then also identifying the organizations to provide the vaccination. So when it comes to identifying the community partners, these are the 4 things that come to my mind: community organization, faith-based organization, health department, and the community liaison. And the most important, the point in this is the community liaison. And I wanted to say that the community liaison is the most important because they are the one who serve as the public face of the organization, in planning, in training, in meeting, being the bridge between all other 3, providing information and answering the question. When it comes to the request can come from anywhere. The request can come from the health department, depending upon the need, where the vaccination need to happen. It can come from the faith-based organization where the need is, or it can also be from the community organization. But the center is the community liaison, because they are the one who help us in creating the things that I mentioned earlier in my comment, where the need is, how it will be implemented, who will be the folks who will be there, what kind of setting need to be done, how we need to educate, how do we need to communicate, and what are the things that will be needed in order to have a good experience, and what are the resources that we need. So if we can identify these things, then it helps in making a good event at the end. The few examples that I can give is for the faith-based organization. I know we personally did a lot of work with churches. We did a lot of work with mosques. We had several meetings with sheikhs who were an integral part of the community, and we were able to help in navigating the hard conversation when it came to the vaccination. We were in constant communication with the health department, because health department has data and statistics where the need is, and they can provide us the resources. So these are the couple of the examples. As far as the community organizations, I want to say there are several things that you can think about the community organizations. We communicated with WellShare, we did the Wilder Foundation, we had collaborated with CAPI, and all these organizations, they do serve the refugee, immigrant, and the migrant communities. So in order, and then they have the trusted relationship. I think that is the biggest piece, who has the trusted relationship with these communities, because they are the one who will be, because these patients and the communities are not going to go directly and seek care. We have to pave the path where they can comfortably walk and find the care. Can we go to the next slide, please? And this is the biggest piece that I wanted to address. I know in the beginning there was a lot going on around the vaccine hesitancy, especially when it comes to the refugee and immigrant population, that people are very hesitant, whereas that was not the case. Data proved it that was not the case. It was more about people were looking for more access and the education what the vaccine is. And so the first important step was that how do we assess the confidence of the community members and provide the language, because the appropriate language and because the health literacy is true, there are significant barriers to health literacy for several communities, and specifically for, I want to say, Somali, Hmong, Southeast Asian, and several other communities of color in Minnesota. Somali language is very new. It developed in 1990. So it's a lot of people that we see, they can speak, but they cannot read Somali language. So we making sure that the information is available in both written form and also in visual forms. The barriers to the health literacy is, it stems from the combination, not only from the language, but also from the culturally relevant communication. There are so many barriers to enter and navigate the healthcare system when it comes to culturally relevant communication. So how do we create the material which is culturally specific and sensitive in terms of the oral and visual communication? A lot of time oral and visual communication is way better rather than just writing things on a piece of paper. People use different medias, and identifying which population is utilizing which media, because some will go to local newspapers, some will go onto WhatsApp, someone will go on Facebook or Instagram or local radios, local TV channels or Twitter or YouTube or podcast. So there is no one way. We need to identify the need in terms of like where we provide the education, and that's where the community liaison person comes in, and they bring their knowledge and skills to create the structure when it comes to educating. And also monitoring the social media, because we noted that a lot of wrong information was going on into those social media. We heard from our Hispanic Latino communities that there was a lot of information around infertility, that vaccine were causing infertilities, or people were intentionally giving the vaccine to the Hispanic Latino communities because they have a lot of children, or there were belief around a lot of data is being collected and they are keeping track of the data so that the people can be deported. Or there was a lot of information about the content of the vaccine, which was there might be pork in the vaccine. So watching the social media and making sure that we provide the right information onto the social media is important. Also, at the same note, like who is providing that education when it comes to the vaccine confidence? Seeing people who look like them and speak their language, that makes a huge difference. And having real community testimonials of safety and effectiveness that plays a very important role. When I see my patient, the first thing that they ask, did you get the vaccine? And then they will turn towards my interpreter and they will ask, did you get the vaccine? And then they will ask about the side effect or how you felt after the vaccine. So being truthful to them, giving them the data, giving them personal experiences, and being real. I told them how I felt because I had my own personal reservations, even though I got the vaccine like very in the beginning, but because I have the knowledge, I have the resources, I had access to the real data, I was in a position where I could provide that information to them. But also setting expectation. Yes, you will feel sick, maybe a little bit for 48 hours, and that's okay. And what you can do to take care of those symptoms, and it is not going to be lifelong side effects. So just making sure that we're answering that question. And at Cook, we also utilize a technique which is called elicit, provide, elicit technique, which is a motivational interviewing technique. You elicit what are their concerns or the question, and you provide adequate information, and then elicit question again. So let's say if someone would say, well, I think it is a microchip that they're going to insert in my arm. So then you provide the information about what is the mRNA technology, how it works, and how long it lasts, and it's going to be destroyed soon enough, and how it is going to be improved, like putting the immunity in your system. And then you ask the question after providing the information, if they had any further question. And then putting the patient or the community member onto the driver's seat so that they can make the decision rather than there is not a sense of there is a sense of urgency, but then we have to be very meaningful and mindful. How do we navigate that sense of urgency when we are giving the vaccine to the folks so that they can make the informed decision? And being at the FQHC, I mean, we know that the FQHCs, and the data just came out a few weeks ago, FQHCs were the highest when it came to providing the vaccination into populations who were living at the highest social vulnerability index areas. FQHCs provided 63% of those vaccination, which was the highest. And the reason that we could do is that because we had those relationships, we created the material which were culturally appropriate and created the environment where the people can have access to the vaccination in the right way. And then identifying the organization to provide the vaccination. I will go back again, and these three steps are not separate. These are all interconnected. The example that I can give, one example that I can give, and I know my colleague OP is going to be talking more in detail, but one example I can give is that I connected with Sheikh, who is a main sheikh at the mosque here, at local mosque here. And we were looking at how can we improve the vaccination in our Somali and East African communities. And he suggested, how about if we host an event at Cook and all the sheikhs from all over Minnesota come and they talk about the vaccination. So we hosted that event and 16 sheikhs came from all over the Minnesota, including greater rural Minnesota. And they took their vaccination, and Somali BBC and other Somali local channels were here. They were covering it, and it was shown into the local channels, and they talked about their real experiences because some of them have already gotten the shot. So it was a mix of the people who already got the shot, and then some of them were going to get the shot. The information that they provided was so culturally sensitive. I would have never been able to provide that information in that language, and that helped in building the trust. And then we provided the access to the vaccination. We said the next step was, well, Ramadan is around the corner. How do we, then the community started asking the question, well, we want to get the vaccine before the Ramadan happens. How can we do that? So then Cook said, well, we can do that if you can create the spaces. So then we connected with the community liaison. We figured out the space where we will be going. We figured out the structure. And then there was a lot of information that needed to happen in terms of outreach and the education, what type of vaccines are available, what type of vaccine community wants, and what are the timings in terms of that particular community, which timing will work. And we were able to do that here. And I'm just giving one example, but we have done several things. We have provided information, we have done the vaccination at a gas station. And the reason we decided to do the gas station because we do serve a lot of patients who were experience homelessness. And we were told that a lot of people go to that gas station, probably that will be a good location to do. So that is one example that I get, but I hope that everyone got a understanding, like what is the structure that needs to be in place in order to have a good vaccination event.
Thank you, Dr. Dwivedi. I really appreciate that. Just a quick reminder in step 2 that Dr. Dwivedi mentioned, the slide showed a lot of resources, and those resources are available at our website, nrcrim.org. Feel free to download it, put your own organization's logo on it, and use it for your campaigns. We'll be happy for you to do that. Now, for our next questions in our chat, who have you partnered with to reach RIM communities during COVID-19? Are there specific organizations or individuals you've done? And then who would you like to partner with in the future? So if you can put the answers to the question in the chat box, we'd appreciate that. And if you have not partnered with anybody, it's okay to put none too. Good. Richard indicates that home health agency that employs many refugees. That's excellent. And city health departments. Thank you, Richard. I'm seeing more conversations about local businesses, especially specialty grocery stores. Good one, Lula. Carol mentioned refugee and immigrants receiving organizations in New Hampshire. Excellent. I liked Lula's mention of the specialty grocery stores that cater to particular communities. Any other thoughts, other organizations that either you have partnered with or planning on partnering with? Specialty grocery stores and restaurant chains, excellent. Jonathan mentions Head Start programs, ethnic organizations, grocery stores and shopping areas, especially with Eid holidays. Food shelves, good one, Rolly. Goldmarie, religious organizations, community organizations. There's another one from Lula, city parks and recreation. That's an excellent one. Lot of community organizations and religious groups, schools. Excellent. You're seeing a wide variety, and I like the fact that a lot of you are emphasizing specific niche groups like the specialty grocers and things like that. Labor organizations, county fairgrounds, that's the one that's exciting, especially during the summertime, eh? So as you folks put in the answers, I'm going to invite Dr. Adesida to walk us through the next steps. Dr. Adesida, and next slide, please.
Thank you for the introduction, and thanks everyone for joining. So I would be going through steps 4 through 5. We'll take a quick pause and I would come back for step 6. Next slides, please. Step 4 would be planning the vaccination event as we're collaborating with community partners. And for this, the very important thing that we want to do in the beginning is we want to assess the community's needs. So you're partnering with community partners, but you're not just going in and saying, okay, it's vaccination. You want to know also from their end, what are their needs? Are there language needs that you should take into consideration so that you're making sure that you have people that speak that specific language and you're able to accommodate for that? Are there additional cultural needs? Are there, like some ethnicities or cultures, there might be need for you to be able to provide like same gender providers, same gender vaccinators. So we need to take into consideration all of those things. Are there work schedules that you also want to take into consideration? If you're doing it on a work site, you might want to be able to say that you want to do later in the day for the vaccinations, or do you want to put this on the weekend so that you can accommodate for people that would just be getting off work and can have like an evening vaccination event? Also, if you are doing, like if your community partner is an employer, then you might also want to be able to say, okay, let's do this staggered vaccination clinics so that we are not vaccinating all of the employees at the same time. So you might be able to have like 2 or 3 different vaccination events just to accommodate for different work schedules. You want to, as you talk with the community partners, also outline the roles and responsibilities. What are your roles and responsibilities as, like a community clinic or health department providing the vaccination, and what are their roles and responsibilities as the community partners? Some of their roles and responsibilities could be, are they helping with outreach? Are they the ones helping with registration? Are they providing volunteers? But it's good to know as you talk in the initial discussions to be able to divide up those roles and responsibilities so that also the community organizers know what is required from their end, and they are also clear on what your role would be as you're planning the event together. You could also offer additional services. So we found that as you tailor this services to the communities that you're partnering with, if it's a lot of like unsheltered population, it's a simple thing as like socks or personal items can help. You can offer like a snack bag, hot meals is always a good one. Additional, the community partners might also have other community organizations that like they work with or they're partnering with that could be able to provide additional services. There might be some need for having insurance navigators or care coordinators. If you're able to bring all of that in addition to the vaccination services, then it's always good for the community partners. There is a community partnership form that is Appendix A on the NRC guide that has a list of questions that you can have ask community partners, and you can also have them ask you as you're thinking through what is the process for the vaccination events. There's also fact sheets, some of them have been shared earlier, that you can tailor, and you can also share with the community partners, have them tailor these fact sheets to use for the vaccination campaigns. Also just, like encouraging them to go on the NRC Ream Vaccine website to be able to find all this information. You can also provide the information for them as well. Next slide, please. So as you continue to talk with the community partners, you want to hold the event in a familiar location. So depending on who your community partners are, some of them might have a space if they're meeting in person where they already like have their community members come into. So that would be a good space that you can use for the vaccination. There might be a community center close by, faith-based organizations might have a space. It might be a work site like the meatpacking that we had made reference to in the case earlier. And some of you had also shared in the chat additional like different areas that you've held community vaccination events. So once the space is identified, then the next thing would be a pre-event site assessment. You want to do this assessment and have at least 1 or 2 people from your team, I would say more than one most times, from your team come out to do the pre-event site assessment. This you want to start, like right from things such as like parking. What does parking around the location look like? And as you come in, where would be the preferred place for, if there's registration, where would the registration staff stay? Where would the vaccinators be? Is there enough room? Is there enough room for social distancing while people are waiting, and social distancing while they're in the vaccination? Is there a different exit, or is there a different entrance and exit? What does the direction of flow look like? So this is basically when you do this pre-event site visit, then you have kind of like a layout of what the event would look like. And then you're able to see, okay, where are the power sources? Where are the outlets? Will I be needing power cords? Where would I be able to station people that need to have the laptops plugged in for your staff? And then also for the community partners, you know, like where would their volunteers be? You would have had discussions with community partners on how many people would they be anticipating from their team will be there, and you know, from your team as well. Organize as one of the organizers, how many people are anticipated. So being able to account for everybody, and as you think about the flow and what it would look like, each of the stations, and you're able to account for each of the stations and what the flow would definitely look like. If you're doing an indoor, you would want to have, you know, like HEPA filters for an indoor vaccination event. So you want to also think about ventilation. Will the windows be open? Because these are additional information that you want to also provide to your team who will be coming for the vaccination, and also letting the community partners know what is needed. An example I'll give is one of the times where I've done a pre-event site assessment was when we realized that, okay, we would need dividers for each of the vaccination stations, because we were working with a particular community that a lot of them would not want to expose, you know, like their shoulders. So we needed to have each of the vaccination stations separated. And if we had not, you know, done a pre-event site visit, we wouldn't have been able to identify that that was an additional thing that needed to be provided prior to the vaccination event. Then you want to advertise, and we want to advertise through community partners as much as possible. We want the community partners to be empowered. They're the ones that are you know, like in direct relationship with their community members. So part of some of the resources that we have said are available through the NLC RIM can be customized. You want to have them use their preferred language, because sometimes when we interpret, or what we're interpreting, doesn't really come off as, you know, like how they want the message to be communicated. So you want them to advertise, provide resources for them. Also, you can also provide some education to them, as well as what is, you know, like what is required, what do they think you should address. And then you can also have them advertise several social media, their preferred social media outlet, their preferred outlets of advertisement, have them advertise the vaccination event. Can I have the next slide, please? So step 5 would be conducting pre-registration for the vaccine event. And that is if you are doing pre-registration. I know that some organizations might be doing a walk-in type, but in the event that you're doing a pre-registration for the vaccine event, this would help you estimate the number of vaccines that are needed, and also the type of vaccines. If you're bringing, you know, like more than one type of vaccine, then you're able to estimate for each of the different vaccines, how many are we anticipating to bring out for the vaccination event. Pre-registration for patients can be done through, you know, it could be phone calls. For some communities, they want you to table at an event prior to the vaccination event, just so that you're familiar with their members. Some other communities also, you can also do the pre-registration through a secure online form where you have access to that form, your community partners have access to the form. They're able to register, the participants, and then you have access and you're able to update that. For the registration, minimal, you know, personal information should be shared, as minimal as possible. Just, you know, first name, last name, age, contact information if you need to get a hold of someone is mainly a lot of what you would have for the pre-registration. Also being aware of the particular communities that we are serving and how sharing personal information is perceived. Then you also want to confirm from your community partners, are they in charge of transportation? What are the transportation needs? Are the transportation needs met for the people that would be coming for the vaccination event? And you want to send reminders. If it's reminders from your clinic, if the community partners are the ones sending the reminders, make sure that there's lots and lots of reminders, because if you're pre-registering, you're doing all of this ahead of time prior to the event, and you don't want a situation where a lot of people might have, you know, like forgotten about it, or some things that have happened is that people have had other vaccination sites open up and they've gotten vaccinated. So you also just want to have, so that you're having as close a number as possible to the people that would actually be attending the vaccination event. And like I said, if pre-registration is not able to occur and you're doing working, just ensure that you have additional space on site, and you have, like available staff and additional people from your team that can help with on-site registration. Next slide, please. I would pass this on to Dr. Prasad now.
Dr. Adesina, thank you for that. Now, before I ask this question, I would also invite you folks in the audience, if you have any questions for the panelists, you can start putting them in the Q&A section. Again, the Q&A section is in the bottom of your screen. Click on that, and you can put your questions in there. And as you're doing that, here is a question from us. What concerns do you have about holding a vaccine event? Or what concerns have you had while you have held a vaccine event in the past? Have you had any challenges hosting a vaccine event? Or are you concerned about setting up a vaccine event? Chris mentions getting enough people to show up. That's a good one, Chris, because I think you always wonder if you're setting up an event and if there's not enough people who show up. Lula mentions finding an appropriate location. We are a local government and want to make the community comfortable. And I think that's a very critical point. It shouldn't be in a location that is, for lack of a better term, threatening. Carol mentions the importance of interpreters, always very important, including sign language interpreters and other accessible communication leads. Richard mentions the challenge of getting children vaccinated. Jonathan brings up a very important point when we have folks who are undocumented, they may use one name for work which isn't their own, and they may use another name for the card. They can't show that to an employer, which in itself might be a challenge. Good. And as you folks are putting the answers to that question about concerns about holding a vaccine event, I'm going to invite Dr. Adesina back again about the step 6 plans.
Thank you for having me back. So step 6 would be holding the actual event, and also at the end of the event, debriefing with the community partners. Next slide, please. So for holding the vaccination event, you want to do like a before the event, what are the things that you need to get done? So there's several checklists, and all of these are also available at the in the NRC guide, and there'll be Appendix 6, C through F. Checklists for the mobile COVID-19 vaccination. So what do you need to have? Things as little as pens that you need for registration and clipboards, everything that you need, you would do, it's advisable to have a checklist, do a run through of what do the vaccinators need, what the providers need, what does each station need? Do we have the vaccination cards? Do we have the EUAs? Just putting together everything and making sure that everything is all set for the event. Then you also have to take into consideration like safety considerations. A lot of these events might be after hours, because you want to accommodate for different work schedules, and that some of them might be on the weekends as well. You want to also take into like consideration what is the safety of your team that you're bringing out there, and also the community partners and the community members that you're vaccinating as well. Then you also want to take into consideration like what is the schedule and what do you need to do to make sure that if for example if there was like an emergency, what does the emergency preparedness plan look like? Do everybody that is going to be on the site from your team, do they know where they would huddle? Do they know what they need to do as the next steps? You also want to look at the vaccination infection control checklist. You want to make sure that if you're doing an indoor vaccination, that you have HEPA filters, that ventilation is going good. You want to make sure that sharp containers are in the right places and sharps have been put in the sharp containers. There's a lot of things on the checklist, like I said, that would be as appendixes in the NRC guide. And then you also want to do like the mobile vaccine setup checklist. What are the things that I need for the mobile clinic? All the checklists are available and we can make reference to those checklists. Next slide, please. And then at the event, so as you, the day of the event, you want to make sure that all of the volunteers and staff from your team as, coming in as the clinical partners, you want to make sure that all of them sign confidentiality agreements. If you also have volunteers through the community partners, you also want to make sure that they sign confidentiality agreements. If there would be some pictures taken that would be used, in future, you also want to make sure that there is like a photo release media form that all of the volunteers from your team and the volunteers from the community partners also sign, just making sure that they're aware that you would be taking pictures. And that also includes like participants that will be getting vaccinated. If their pictures will be used for, future, then you also want to make sure that they sign the photo release form. To the volunteers from your team and the community partners, provide clear instructions on what personal information is being collected. Some of it was what I shared previously, like name, age, and also just being aware of how the personal information is perceived, especially in the, RIM population that we are dealing with. So volunteers from your team should know what information is being collected and be able to provide that information. Then you also want to tell everyone, instruct the volunteers verbally and also reinforcing through printed documents, things that they should know, sort of like, what are the vaccine side effects, because so that they can be able to answer some of the questions that participants might have. Because as we've done this vaccination event, a lot of times, some people have actually come to the vaccination event just because maybe a family member said, hey, let's go get vaccinated, but they're still waiting on, additional information. They want it as a time to touch base with providers and, the nursing and everybody on site to be able to ask further questions to better inform their knowledge. So you also want this information to be printed out and available at each station, because you don't want like halfway through a vaccination event where, one of your staff or team members has needs some information and they don't have something that they can reference. Next slide, please. So some other considerations would be that, and this is very important, that participants' first encounter should be with staff who speak the preferred language. Even if you're not able to make it as a first encounter, but one of their first few encounters should be someone who speaks the preferred language. It's, people have shared that it's welcoming when they come for a vaccination event and they're able to hear someone just, converse in their preferred language, that you just see the smile on their face as they're able to, that's welcoming, it's reassuring for them. They're able to make better conversations with people and they feel like you took into consideration, you took them into consideration as you were planning the vaccination event. Also ensure that staff is present, that you have additional staff, on your team, the community partners as well, sort of like before the event, and we talked about that previously, just doing like an assessment of how many people do I need from my team to be out there, how many people do we need from the community partners, making sure that there's enough staff to help with things like, registration, traffic flow, where to put the cones, where to direct the vehicles for parking, and then also, like education and monitoring, like I've referenced before. Also, another big thing is reassuring participants that their names and contact information is going to be kept confidential and you're not sharing that, with additional people. And then at the end of the event, you would want to debrief with the community partners. This is also very important because you want their feedback. You want feedback from them. You want to see, what you can do, better. And you also want to see how they feel the event went. And if there's, like additional ideas and things that they have that they can bring forward, that you can both collaborate on, because if depending on what vaccine they got, there would also be a second dose vaccination event. There'll be future events that you would be planning with them, or, like through them to be connected with other community partners as well. And then the last one would be that in the event that you're not able, for some reason or the other, you're not able to hold this vaccination event with the community partners, and then always make sure that you're able to hand them off and link them with maybe a local public health department or another, like the clinic or another partner who is able to help them do the vaccination. And I think that would be all. I would hand it back to Dr. Prasad.
Thank you, Dr. Adesida. Now, the two things I want to remind folks. One is the Q&A section is open, so please feel free to put in questions there for our panelists to answer. And then for a question from us, have there been some examples of creative locations or practices, not just locations, but or practices where you've held a vaccine event or heard of others holding a vaccine event?
I can give a response.
Go ahead, please, Jonathan.
This is a specific example from the last 2 days, and where we had events in the Head Start buildings for migrant education, and they were very successful, largely because parents were coming to pick up their kids, and they were familiar and comfortable with the place, and everybody spoke Spanish. So that was very, very helpful to have, because people were familiar with that location already.
That's a good one. Go ahead.
I can give an example too. I'm originally from India, and I volunteer for an organization. And what happened during the COVID is that a lot of families, their parents came and they got stuck here because they couldn't go back during the pandemic, and none of them have insurance. So we worked on that and were able to, and all these parents who are older, they feel very comfortable in going to the temple. So we were able to facilitate and organize the events at the temple, where all these folks who were not immunized and were not able to go back to their countries, did not have the insurance, but got the vaccine.
Thank you, Dr. Dwivedi. That's a wonderful example of recognizing the challenges in one particular community. Jennifer Reyes had an interesting one about in front of an apartment complex close to where they live. That's a good one. Chris has an idea of having a mobile vaccine truck with in front of a food truck. I would go to that, right? A good food truck and vaccine. Courtney suggests airports and public beaches. Jonathan has 2 taco trucks with support of 3 meals for vaccination too. That's a good one. Chris indicates that with Black Nurses Rock to provide vaccinations in the Black community. Lula had a very small clinic at a refugee services building for community elders. And Maricela has a EOC truck as a mobile clinic and the community's Juneteenth event. You know, the Juneteenth event is a good one you bring up, Maricela, because around the world, there has been mass vaccination campaigns that are paired with community events, either community festivals or religious festivals or community events of that kind. But getting the community's confidence in arranging for that, I think, is critical, recognizing it's an important day for folks from the community. I like those suggestions. Dr. Kirsch, you had something to mention there?
Well, no, somebody had asked a question in particular about what do you do if somebody is not wanting to use their name. And there's no requirement of somebody using their real name. There are quite a few employers that are requiring their employees to have vaccination. And so if they have a different name, you could give them 2 cards that they can use. They could use their real name, which they may need for something else at some point, as well as whatever name they're using for employment. It's very common. You could just ask. You could assume that they, or you could say, what name would you like me to put on here? Because it's quite common. So
that's a good one. I particularly like the 2-card strategy in case somebody wants to use it for work. Yes, good one. I'm going to transition us formally to the Q&A section. Next slide, please. And this is where you get to ask our panelists questions. And we already had one question from Goldmarie. I'm going to start this question off for Dr. Kirsch. Best practices for mobilizing small pockets of unvaccinated immigrants to mobile vaccination events. Any particular suggestions there, Dr. Kirsch?
Some of them are ones we've already that we've already done and spoken about, but having food or music or having another reason for people to come. And then also what Dr. Adesina had mentioned as well, is it's really nice to have some other services offered. Some people feel like they're sort of giving up their time, which they might be from work, and having some other things, especially if there's food insecurity or lack of access to other services. We've done MinSure, which is basically a navigator for insurance. We've had those available, and we've had dentists that have volunteered. And so it really does draw people, and we've done vision screening. So I think that those kinds of things can attract people to come there if they're not thinking only in particular about getting the vaccine done. So.
Thank you, Dr. Kirsch. Dr. Adesina, anything else you would like to add to that?
I would say, in addition, if you're able to get who the community leaders are for that, like specific pockets, if you're able to start conversations with them, build trust with the community leaders, and let them know that like you are really trying to provide the vaccination and additional support that can support their specific needs, and you're collecting just minimal information as much as possible, but also continuing, like to build trust and strategic partnership would be my addition.
Thank you, Dr. Adesina. Dr. Dwivedi, I have another question for you. What advice do you have for a health department, a local health department that is looking to connect with a particular community, probably for the first time?
It's making sure that we are using the right people. So as I said in the beginning, the community liaison are the most important people. And rather than just going, because it has happened, rather just going and doing things to the community, identifying the folks or the people who that can do the things with the community. I think that is the most important piece. So identifying the community liaison first, and then talking with them, creating a structure, and then learning what are the needs rather than just telling them what to do. I think that is the good way to start the communication and setting the ground and the stage, and then engaging them and then going from there. That's what I will say.
Yeah, you bring up an important point. I think a lot of times when we do community engagement, we talk about it being a long-term partnership, not a one-off. And if you don't have relationship with the community, it's probably important to keep that in mind as something you build on. Richard has an interesting question that's almost a follow-up of this. With so many organizations using so much of public and private money to do this work, is there a risk of making people feel that they're being chased? Is overlapping coverage good, or should we try to specialize? And Dr. Adesina, I'm going to bring you for that question.
I would say that there is definitely a risk of people feeling like, oh, why is everyone chasing us with vaccinations? But also providing the information, like what is the information that we know? How has vaccination, like helped us with the COVID pandemic? So providing that information, letting them know that, even though there's several other places and there's different public and private entities and money for all of this work, like really sort of like bringing it down to what your particular organization, clinic, or health department's goals and missions are, and how you are helping, to reduce whatever barrier it is that they're having to vaccination. And I think, like also emphasizing for organizations, community, and public health departments, being flexible. Like we initially started out with pre-registering because that worked for us for the several clinics that we had done. But also as additional spots have opened up, and as like people have been more vaccinated, and we are now trying to get those little pockets of people that have still not been vaccinated, then you're able to even sometimes we're able to provide like just walk-ins, and we are saying, okay, we don't even require a pre-registration. We have enough vaccines just coming. So also being flexible with your structure and with planning the vaccination events.
Thank you, Dr. Adesina. Dr. Kirsch?
Yeah, I would second everything Opie, Dr. Adesina just said. I very strongly, and I also, I would also say that, you know, that the health equity problems that exist for a lot of communities was present before COVID, and it'll be present afterwards. And so I think, you know, there's a risk of saying, okay, well, we only care about this community because they've got a transmissible disease. But on the flip side, utilizing this to saying, hey, this is, you know, we care about this community, and you know, COVID's one of the reasons that we do, because it has worsened health disparities. But it's not the only reason why we care about the community, because you could potentially, you know, if people feel like they're being chased, you could potentially, you know, reverse some of that trust. And so, you know, offering incentives is fine, being pushy is not. You know, I think that having that trust, and even if nobody gets the vaccine, but you say, hey, we're going to offer this, and we encourage people to come back, and we will help facilitate you getting vaccines in your time when you're ready. You know, I want them to desperately, because I know it's better for them. I know it's better for the community. But there's also a risk of reversing some of that trust. And I want to see long-term health equity improved. And so use this example and use this crisis to develop relationships which can better health equity going along, you know, in the long term.
Dr. Kirsch, you bring up an interesting point. I think one of the things we always talk about in community engaged activities, you never do things to the community, you do things with the community. Because when you try to do things to the community, it's your agenda. It becomes your agenda, your goal. Whereas when you do things with the community, it's a community's agenda that you want to make sure that it's happening. So it's a beautiful answer. Thank you for that. I want to bring this up that Joanna mentioned at the Phyllis Wheatley Community Center. We have redeveloped our vaccination clinics to have resource specialists on hand to navigate people through various social resources such as housing applications, SNAP assistance, etc. We will also be offering free meals, groceries, and childcare for vaccination participants. Thank you for that, Joanna. I think one of the ways to look at it is as vaccinations, or, you know, in the community-based vaccinations, as a part of the other services being done. That, I think, is a beautiful strategy rather than a standalone event too. Thank you for that. Now, I have a question for all our panelists, and this is primarily to see, have you observed any practices that have been bad or lessons learned, we shouldn't be doing this again, that you'd like to talk about? And I'm going to ask Dr. Dwivedi to open this up.
Yes, and I will start with, first of all, I'm going to first acknowledge the question I think Richard asked. And I wanted to acknowledge that question. That was the greatest question, where it says chasing. And I thought what is being asked is like, how do you address trauma? So coming back to your question is that when we do things, or when the healthcare goes to the communities, the most important thing is that how do we reflect upon the lived experiences of the refugee and the immigrant and the migrant population? How do we provide the trauma-informed and the trauma-based care and not add to their trauma? I think that is the most important piece. And I will start with the testing. Actually, there's a lot of trauma got done to the communities when it came to taking even the nasal swabs. People started, there was a lot of talk around the communities, my brain is getting hurt. That swab goes and it tickles the brain because we use the language tickling the brain. So which language we are using, how we are informing the communities, and how we are setting the stage is important. The same thing happened with the vaccination, giving them the adequate information about we know that the data proved at some point that after the first vaccination, a lot of people were not coming for the second vaccination because they did not get enough information how long the arm will be hurting, how long they will be sick, or how they can address this. There is no way that these symptoms are because of the COVID. A lot of information got like, oh, you will get COVID-like symptoms. And there is a difference between, no, this is the response that you are getting from the vaccine rather than COVID-like symptoms. So how we are educating the community. So these are so the thing that I want to say is that the language piece is super important when we are doing. So that will be a practical consideration, and informing the community before doing anything with them.
Thank you. I appreciate you bringing the point there, because I think it's important to keep in mind that any community engaged activities can have spillover effect that can last for years afterwards. I appreciate that. Dr. Adesina, any quote unquote bad practices or things that you would say are not very productive?
Yes, definitely. Some of it would be, like always addressing like misinformation, because there would be a lot of the community members and the community partners that, from social media, various different other outlets have had misinformation about the vaccine. So addressing that, always being upfront and addressing that misinformation as you're talking with partners, and letting them know what information is out there and available, because they would be the ones doing the outreach, and they can then provide, like better information to their partners and members. And also, if you, like one thing that happened in one of the events was where we were doing a collaboration with multiple partners. So just making sure that everybody is on the same page, that there is, like a central group or email, whatever it is that you're using for communication, because there was like a silo, another community organization that was added on by, one community organization was siloed, and the information was just going down to them, but it wasn't shared information such that when we got to the event for the day of the vaccination, like timings was wrong for information that they had, and specific, like registration requests and who was going to be vaccinated first. So just making sure that if you're partnering with more than one community partner, there is a central group, everybody is on board, and everybody has all of the shared information, and it's not in silos.
Thank you for that. We, unfortunately enough, fields operate in our own silos, and we take our silos into the community. Thank you for that message. Dr. Kirsch?
The only thing I would add is that, some populations are not very comfortable with having certain security figures there. And some events have used police or National Guard as, to help. And I think some populations probably would feel comforted by that, and some probably would be uncomfortable with it and may not show up. And then again, this is kind of echoing what Dr. Adesina and Dr. Devetti said, but what having utilizing that time, especially because people have to sit there for 15 minutes afterwards, and having that time to just kind of talk about it, ask questions, ask people about what kinds of concerns that they've heard from other people, and having, helping to have them be ambassadors out of their own goodwill because they have experienced this, and asking about things that maybe have worried their friends and family about coming. And so I've learned a lot just sitting there with people and asking. And I think, you can gain more trust there by showing that you care about people and not just shuttling them through by engaging in conversation and learning from them.
This is an important point. I think trying to get to where the people are. One other example I can think of is a large campaign where a political party was involved, and that is probably not the best way to get about going this, because people then ask you the question, what's your agenda here? Why are you doing this, right? So it's important to understand who you're partnering with and what their agenda might be. And so, Dr. Adesina, again, I'd like to acknowledge what you mentioned, recognizing what every group is and making sure that your communications are good between the groups and very clear would be really important here. If you have any other questions, and this is for participants, if you have any questions, please post them in the Q&A box. What I'm going to do right now is transition us to the next slide and talk about what we are planning on next. Number one, you folks, participants today, will receive an email from us. We would appreciate, and a survey too, and we'd appreciate the feedback. We take feedback very seriously. Like I mentioned earlier, and like our panelists mentioned earlier, please go to the nrcrim.org website and browse through all the resources. Feel free to download and utilize them too. We'd appreciate feedback for today's session. We are going to look at the feedback really seriously, and we are looking at planning our next session. We haven't decided what the content and what format that would be. So we'd like to hear from you. What is it that you want to know about community engaged activities as far as COVID-19 is concerned? Is it about vaccination? Is it about anything else? Please let us know. So that email should reach you this afternoon. So we would again appreciate you giving us that feedback. And now for closing thoughts, I'd like to bring our panelists back in for any closing thoughts about today's webinar. Dr. Dwivedi, I'm going to start with you.
I would say when it comes to the healthcare, whatever we can do to bridge the gap between the healthcare and the communities and bring both at the same table or at the same level so that it can be, and actually maybe empowering communities more so that it can be community-led and community-informed care rather than healthcare-led and healthcare directed.
Beautiful message. I really appreciate that. It should be the community's agenda. Thank you for that. Dr. Adesina?
I would say that in doing this work, building strategic partnerships is really key, and letting community organizers, community partners know that, like you're a trusted entity that they can, be able to partner with. And also just being able to provide vaccinations to people who otherwise, might have not been able to gain access is a really rewarding feeling. And it's something that we should all strive to continue to do.
Dr. Adesina, I really appreciate you bring up the word strategic partnership, because I feel that the benefits would far outlast the COVID vaccination campaign, right? Because it could be for other diseases, other conditions, and what Dr. Dwivedi brought up earlier, it could be a beautiful bridging between healthcare systems and communities. So I really appreciate the strategic partnership angle that you brought up. Dr. Kirsch?
Yeah, I would say, I echo what the other two just said. And again, but I would also say that, just approaching this with humility and recognizing that we don't really know everything about what people's needs. And, we have a lot of resources on the NRC RIM site, which is a helpful place to start. But I don't want to assume anything about communities. And so I ask questions and like some of the other examples, like not showing your arm, that, things that you learn as you go and as we ask. And I think that helps gain trust as well, that you care and you want to listen, and that we're not using a top-down, I'm the doctor, so I know everything kind of model, which a lot of people are used to. And I found it very rewarding and refreshing to hear people give feedback as well, and and being open to that, and it is incredibly important. So
thank you, Dr. Kirsch, and folks who are listening. I have the privilege of working with this amazing group of people who are all very humble, who are all open to changing their opinion, open to learning from others. So really appreciate that. And before I close, my particular thanks to folks who have made this happen, people who are working in the background to make sure we have a wonderful session. Deb Friedman, Erin Mann, and Anna Pendleton. We couldn't do this without you. And for all of you participating, thank you. Looking forward to future conversations. Have a great day.